Talk about the vertebral artery. So it is a branch of the first part of the subclavian artery. Let's talk about its course. So in order to enter the neck, it has to pass through the foramina of the transverse processes of the upper 6 cervical vertebrae. So from 6, it is going to enter the neck. And to enter the skull, it has to pass through the foramen magnum. And then from the foramen magnum, it has to pass through the dura mater, and then into the arachnoid, and then the subarachnoid space. And then finally, it is going to enter the medulla. Then at the lower border of the pons, it is going to join the vessel of the opposite side to form the basilar artery. Now let's talk about the branches. The branches are anterior and posterior spinal branches, pica branch, which is posterior inferior cerebellar artery, and then two branches with the initiating letter of M, which are the meningeal branch and the medullary branches. Vertebral artery is also a branch of the subclavian artery, and the subclavian artery is a branch of arch of aorta, which arises from the brachiocephalic artery. Now let's talk the branches. So first of all, let's talk about the meningeal branches, which are going to supply the meninges, as well as the bone and the dura mater in the posterior cranial fossa. Now let's talk about the posterior spinal artery, to supply the posterior surface of the spinal cord. This is close to the posterior roots of the spinal nerves. And you also have to remember that it is just going to supply posterior part of the spinal cord. Branches are going to be reinforced by the radicular nerves that enter the vertebral canal through the intervertebral foramina. Now let's talk about the inferior spinal artery. Anterior spinal artery is going to supply the medulla oblongata as well as the spinal cord, and it is going to be embedded in the pia mater along the anterior median fissure. That's all. So anterior and posterior spinal arteries, both of them are going to be reinforced by the radicular arteries that are going to enter the vertebral canal through the intervertebral foramina. Let's talk about the greatest branch of the vertebral artery, which is the pica, or the posterior inferior cerebellar artery. The posterior inferior cerebellar artery has an irregular course between the medulla and the cerebellum. So it is going to supply the cerebellum, the medulla, as well as the choroidal plexus, specifically the fourth ventricle. So where in the cerebellum is it going to supply? It is going to supply the inferior surface of the vermis, which is the middle part of the cerebellum, and it is also going to supply the central nuclei of the cerebellum and the undersurface of the cerebellar hemisphere. Now let's talk about the last branch of the cranial portion of the vertebral artery, which is basically the medullary arteries. Medullary arteries are going to supply the medulla oblongata.